starting with a brief anatomical lesson on what is osteoarthritis of the knee. Of course, the knee is that hinge joint that is located between the femur and the tibia and the fibula, so thigh and the lower leg. And it's a hinge joint. It really just bends and it opens up. It's those two main movements. Now, in the joint itself, if we are citing here from our Netter's atlas here, in the knee joint itself, we are going to have at the end of the bony articulations, you're going to have a lot of cartilage. Now, in this depiction here, this is like a younger, healthier type of knee. So we have a lot of productive cartilage in here. This is the front of the knee. That's what kind of the condyle looks like. Lateral here on the side of the fibula, medial here on the side of the tibia. And this is the back view of the knee if we're going deep and everything. Again, the lateral condyles here, side of the fibula, the medial condyle here on the side of the tibia. And what happens with osteoarthritis is if this cartilage, when this cartilage completely degenerates or goes away or disappears and it fails to regenerate, it fails to heal itself back up, then we get to a point where that cartilage isn't in that joint line anymore, kind of like that squishy, gooey shock absorber. So instead, what ends up happening is we get to a point of bone on bone, right, where we're getting a lot more of this friction rub. And as that bone on bone happens, the changes that we could see, three big changes that are often seen on x-ray, is that the bony joint line will get a lot more white, which is known as becoming sclerotic. If there's enough of that bone on bone, then you'll actually get some bony overgrowth on the edges, which are called like bone spurs or osteophytes. And then the last is you'll see that instead of being this nice, healthy, uniform joint line, there is narrowing and sometimes ununiform narrowing. So those are kind of the three big signs that would then tip off a physician to look at an x-ray and say, hey, you have osteoarthritis. Now, most times when we look at those x-ray changes, that's not immediately a guarantee that you have osteoarthritis and that you're in pain. That's why this second part of the podcast is very, very valuable. You kind of have to combine the fact that you have the x-ray findings and tailor that with the symptoms. And